Many of you have been asking about how to elicit a Babinski response in a patient who has underwent an above knee amputation. For that, you should not be looking at the patient's legs, rather you should be looking at the patient's hands. And what you're going to look for is something called as Hoffmann reflex, or always called as Hoffmann response. Let us understand how to elicit a Hoffmann reflex. So for that, you need to hold the patient's hand at the level of the wrist, and you're going to keep the patient's middle finger in a partially extended position. You're just going to flick the nail of the middle finger just like this, and you're going to observe the thumb. So in this case, you can see there is no movement of the thumb happening, no matter how much ever I flick. So this is basically a normal response. Let us have a look at the paretic limb though. I'm going to hold the patient's hand in the same position, and I'm going to put the patient's middle finger in a partially extended position. I'm going to flick the nail, and please observe the thumb over here. And if I flick the nail of the middle finger, you can see there is a slight adduction and flexion towards the patient's index finger, and this is basically a positive Hoffmann reflex or Hoffmann sign. And there is a variation to it, and that's what we refer to as Tromner sign. To elicit a Tromner response, you're just going to rest the patient's hand like this, and you're going to keep the patient's middle finger in a partially extended position, and you're going to flick the pulp instead, and you're going to watch for the thumb movement. Let's see what happens. I'm going to flick the middle finger at the pulp, and you can see that there is a slight flexion and adduction of the thumb, and it is moving closer to the index finger. So this is basically what we refer to as something called as Tromner response or Tromner sign. There you go.